Thank you everyone for coming tonight. My name is Mimi Branham. I'm a speech language pathologist and I am the director of the Carruth Center in Houston, Texas. The Carruth Center is an outpatient pediatric therapy clinic that's on the campus of the Parish School, and the Parish School is a private school in Houston that serves children ages 2 to 12 with communication delays and learning differences. Tonight we are thrilled to have Nancy Kaufman speak to you about her top 10 tips to empower parents of children with apraxia of speech. The audience of this event is meant to be parents. However, we know that sometimes professionals or educators will come in as well. And if you're a professional or educator tonight, we encourage you to enroll in one of Nancy's seminars that are offered through Northern Speech Services. We also want to let you know that enrollment for the Carruth Center's Kaufman Apraxia Boot Camp will begin at the end of January. This is a 3-week day camp for children where they receive intensive intervention from the speech team at the Carruth Center that Nancy has been so instrumental in training and mentoring. And information can be found on our website, which I will put in the chat in a little bit. Nancy is a speech language pathologist and director of the Kaufman Children's Center in West Bloomfield, Michigan. She is a well sought out expert in the treatment of childhood apraxia of speech and has lectured nationally and internationally. Nancy is the creator of the Kaufman. Let's make sure that we're muted, please. Thank you. We're gonna have a lot of people in here. Nancy is the creator of the Kaufman Speech to Language Protocol, also known as the KSLP, which is widely used and respected for the treatment of childhood apraxia of speech. She's the recipient of the Michigan State University and Wayne State University Outstanding Alumni Awards, and is also the recipient of an Excellence in Clinical Service Award from the Michigan Speech, Language, and Hearing Association. While having a very established career and treating children and running a successful company and developing a go-to program for the treatment of apraxia of speech and speaking all over the world, she also managed to have 3 children and 1 grandbaby. So we are expecting a really large crowd tonight because Nancy is a very popular speaker and she has a lot of great information to share with you. I want to remind everyone to please stay muted because we're going to have so many people here. We had over 300 people register for this. I don't think 300 will come, but we'll have enough that if everyone's not muted, it'll get noisy. We do expect to have some time for questions at the end. What I'd like everyone to do is, as they come up with questions, if you will just write your question in the chat box, and then I will moderate them when Nancy's presentation is over. So without further ado, ladies and gentlemen, Nancy Kaufman.
Thank you so much, Mimi. I so look forward to this evening. This is, I think, my 13th year having the opportunity to have a relationship with the Carruth Center and all the speech and language pathologists, and have had the opportunity to observe the Parish School. And I have to tell you, it is just truly remarkable how amazing these professionals and parents and families are. And I'm so proud to be a part of this. So Happy New Year, good evening, and let's get started. I'm just going to go over some 10 tips to just make you feel empowered as parents and what you can do, because we know that we can't just give our children to the professionals. I think that we all have to have some idea of what can we do at home and what would help the professionals who are working with our kids to move our children forward and help them to become effective vocal communicators. And don't worry if your child doesn't completely fit the category of childhood apraxia of speech or CAS, because tonight we're just talking about children who can produce some consonants and vowels accurately in isolation, but they struggle to combine those movements and to be able to produce words or approximations, and that's who we're going to talk about this evening. Okay, so now I can't advance, and I don't know why.
Oh
no.
That's so funny. It was working a minute ago.
I know. Let's see what's happening. Okay, there we go. I don't know why that happened. Okay, so Of course, many of the children who can produce consonants and vowels, and then they struggle to combine them. That's one of the first things that we want to do as speech and language pathologists, is to help the children to get into combining movement.
We have someone who's not muted. Marcella, please mute.
So most
Thank
people
you.
think that we would go right into consonant plus vowel, but that's really a tough syllable shape to combine a consonant with a vowel. We might want to start with CVCV, which means consonant, vowel, which means reduplication, such as words of mama and dada, and what does a sheep say, baba. Those might be some of the first words that we work on for combining consonants and vowels. Or we actually might work on vowel consonant, one of the first things we might do. It might be a little easier to hang on to the vowel and then push on the final consonant. So we need children to have vowels and consonants in isolation in their repertoire. I know that some of your children, or our children, I should say, may not have any vowels or consonants in their repertoire and are completely not vocal communicators. If that's the case, one of the first things we need to teach those children is how to imitate. And sometimes we have to start with gross motor imitation or fine motor imitation, go to gross oral motor imitation, getting to vocal imitation. And if we don't have imitation, we really cannot start the KSLP methods. I'm not going to be delving too much into those who hardly have any vowels or consonants in their repertoire this evening. And many of those children may have autism spectrum disorder. You can learn a lot about how to gain vocal skills with children, especially those with autism, through Tamara Casper's conference through Northern Speech. And I can give you that information later if any of you are interested in her webinar, but it's very, very comprehensive about those types of children. Okay, so we usually can teach kids who do have vowels and consonants in isolation how to combine them. And I want to say that we, in the SLPs that do the KSLP methods, we actually teach approximations toward the full target adult forms of words. And that is absolutely okay to do. We are shaping best approximations toward full adult forms of words. So let's say that one of the children's favorite is Paw Patrol, which is 2 words. They're very complicated words, but they really want to ask to be able to see Paw Patrol. Well, we might have to teach them to say paw, or maybe Paw Pato, or something that's similar before they can get into the full adult form of Paw Patrol. Or we might have to teach them to ask for puppies, because that's a whole lot easier to say. But we're going to talk more about approximations. And some of you may be familiar with my cards. They are just meant to be a visual referent to be able to work on the different syllable shapes of which we would like to target. So the backs of the cards are merely suggestions as to how we can teach an approximation. And we don't necessarily go from the bottom of the card to the top. We find out, hey, let's show an apple to a child and ask them to name it. We listen to how they attempt to name it, and then we try to pull them up toward a higher approximation toward the entire full adult form. We're going to use cues, and we're going to use to fade those cues, and we're going to be totally supportive of the child getting to that top word. So let's say that this apple and the child just says, oh, well, we're going to see if they can maybe say po. And then we're going to push on the a, and then see if we can get appo. And then we're going to say that's correct, but we're going to model correctly. Yes, that's apple. So we're not expecting a new learner in terms of speech motor skills to be able to produce a final L. And we're going to find out what is their best approximation for apple. It might even be appo with a B. But all of those suggestions are something that we want to shoot for. And let's say, for an example, we have the word bubble. And again, we have another final L, which is very tough to do. We might try bubbo. We might have to just go for bub-o or ba-o or even ba. or even just baba, but we're going to find out, hey, what is the best approximation that child can say for the word bubble and get them there and keep them there. And in the meantime, we're going to continue to work toward the full adult target words. Motivation is key. And I know sometimes children will not be excited to go to speech therapy, and that would be our fault as speech and language pathologists. It's our job to find out what is truly motivating to each child, and that might not be typical toys. Some children don't like typical toys, and they might just like to throw things, or they might just like to stir bubbles in a pot or something like that. But we have to find out what is really, truly motivating to them. Very often, there are children that just are not happy to perform. You know, we might be seated near them or across from them, and we're asking them to perform some tasks that are difficult, and they may decide that they're not going to participate. And we should be very used to kids like that. And the solution is let's not ask them to perform anything. And just play with them with their very highly preferred toys and activities. And then we're hoping that the next time they come and see us, they will be happy to be with us because we were the giver of good things. We didn't ask them to do anything. We just gave them the things they love, and we played with them without asking them for performance. But the very first thing that we could do to sneak in some performance is maybe asking them just to do a gross motor imitation, which should be fairly easy. So, you know, we've been playing and we've been providing things for the children that they love. How about let's just say, hey, do this, and we just put our hand on the table. And then they can just easily put their hand on the table, and we start to give them their highly preferred toys and activities again, until we can move ahead into maybe other gross motor movements, maybe some fine motor movements, do this or do this. And they realize that these are things that they could easily do. Even if they can't imitate those motor skills, we could hand over hand help them to imitate them. And then they get reinforced with their highly preferred toys and activities and are happy to try. And then we can even go to some non-speech tasks such as even oral motor imitation, like, hey, can you now do this? And we'll open our mouth. And they're used to doing the gross motor imitation. They're used to doing some fine motor imitation. Now they're going to do some gross oral motor imitation. And then we can shape that toward maybe getting them to produce a simple consonant. Hey, say ah. And they've gotten so used to imitating and realizing that we're going to always help them and always support them in these imitative tasks, that we can then get into vocal imitation and then get into methods such as the KSLP methods. So we really want to see a speech and language pathologist who has a variety of toys and that realizes that some children like STEMI toys, and that's fine, because we're going to have a little bit more of the control over when we're going to give the children the toys and activities that they love. They might just be able to perform one simple task and then they're going to earn a toy right away. Some children can do 3 or 4 imitations or whatever the task is that we're asking them to perform, and then they can gain a toy or so. So sometimes it's good to have pieces of toys that they can earn. And then eventually we'll use really large toys that can't really be broken apart maybe, so that we can work on some language stimulation activities as well. But in the early stages of working on speech motor skills, we might want to have just one little toy at a time to offer the children and try to gain as many responses as we can, while also supporting them absolutely with what they need to be successful. So those are different types of cues that I'm sure that you see your speech and language pathologist implementing. We very often will teach sign language to children who struggle to speak. And I know that causes parents some anxiety. I think the thinking is that if they're going to teach my child to sign, maybe they just believe that my child will never talk. And that's actually the opposite. Sign language is an excellent bridge to vocal communication. And we're not going to just teach any type of sign. We really want to teach a one-on-one match of a sign to a highly preferred item or activity. So instead of teaching general signs such as more, want, please, help, again, what happens with these signs is that they are so general that children will start to use them and just believe that if I just do this, or I just do this, please is a good one because they know that that just makes our hearts melt and we'll get them anything they want. But we really don't want them to use those general signs because in and of themselves, they don't mean anything. If a child walked into my therapy room and they signed more, I won't know what they want. And then they might scroll to another sign that usually gets them something good like please, or help even sometimes, or want. But if we teach children who struggle to speak sign language for the purpose of bridging that to vocal skills, and I can talk about that, but that's a whole conference in and of itself, which would be something called Sign to Talk. Tamara Casper, who I mentioned earlier, and myself are the co-authors of Sign to Talk, and it's a whole technique of teaching sign language to bridge it to vocal skills. But what we like to do is find out what are the children's highly preferred items and activities, and then teach those as a one-on-one match so that they're signing cookie to get a cookie. All right, they're signing open, but in order to get the door to be opened. They're signing cheese to get a piece of cheese. They're signing milk to get milk. And even signs such as eat and drink can also end up being a little bit too general because then we don't know what does the child want to eat specifically, or what do they want to drink specifically. So we want to teach water and juice and milk and other things that they like to drink, or as an example. Some children have an alternative augmentative communication system, and very much like sign language, it's very important to offer these things to children. Again, it doesn't mean that everyone's giving up. It means we're opening up the door to communication. If we just believe, you know what, we're not going to offer them anything like any augmentative communication device because they'll rely on it and they'll never learn to speak. And once again, that's a myth if we do it correctly, where we want to pair vocal speech motor skills with any type of device, just like as we would pair sign language with vocal skills as well. So again, I hope that everyone doesn't feel a lot of anxiety over their children being offered an AAC device, because it's actually only fair. If we don't offer it, then we're really tying the children's hands. We're really not giving them an outlet for communication if they're just at the early stages of gaining speech motor skills. So once we find the appropriate communication device, we're going to always pair their best approximations with the types of things that they are using that communicative device in order to make their needs and desires known. So again, these kinds of things can be consistent to teaching children how to speak. Just it depends on how it's used, and that we're always pairing vocal communication right along with the device. There's an example of some of them. And of course, there's iPad apps. And sometimes the SLPs, and I'm not judging or criticizing because I don't know a lot about AAC devices. I only work on vocal skills, but sometimes the SLPs only know maybe one type of AAC device. It could be maybe Proloquo to go on an iPad. And we just want to make sure that is that the most appropriate AAC device for that particular child's needs? Can they navigate that device well? Do they need something else? And we need to look for the SLPs who highly specialize in AAC devices, because we need their input for sure. So then we're always asking our families to practice. And we don't want parents or caregivers to necessarily try to be a therapist and try to mimic what they have seen us do in a therapy session. But we want to help the parents to practice through play, or actually to practice through everyday things in the natural environment. And we want to make it fun and exciting. I think that what you're going to find is practicing through play is going to give us happier children, better outcomes. Again, rather than the parent attempting to replicate structured therapy, which is very difficult to do. And a child can tell that the parent is struggling to try to replicate structured therapy. They're not really doing it the way they're used to with their own SLP. They'd much rather have the attention of their parent or caregiver in play, and therefore they might be more likely to participate in practicing some of their word lists and best approximations, phrases, and so forth. While we have a game out, or maybe it's a big farm with lots of animals and different things that go along with it, before we take that toy out, we might want to think about a list of the words that the children have been focusing upon and to know what their best approximations have been. And we might want to think of a list of what I call pivot phrases within the KSLP methods. Pivot phrase is like, for example, a pivot word is a word that stays constant. So my is a pivot word. And then we only have to change up one word of the phrase. So my toy, my nose, my mommy. My becomes a pivot word, or a pivot phrase might be I want plus a new word every time, or I want, we can then add in a verb, or take out something, or I have something. But we've worked on them for a great many repetitions so that the children have the ability to use these particular phrases rather than random phrases to communicate. And we're going to teach those to the parents and caregivers, and we're going to know what those are. And then how can we use our toy, and maybe the child is working on CVCV, in which case the animals, we want to say, what does a blank say? So if we have a little horse, we want to say, what does the horse say? So that we can work on neigh, neigh. There are children that don't have an A in their repertoire quite yet. And so we might have to teach them to say nah, nah. But then we're going to model correctly and said, yes, that horse says neigh, neigh.
Oh, Nancy, you somehow muted yourself. Got it? Holly, are you here? Can you help her?
There we go.
Okay, great. Thank you.
Yeah.
Yep, can hear you.
How that happened. Okay. So maybe each animal wants to eat, then eat becomes a pivot word. So we can say horse, eat. We can say puppy, eat. So that the pivot word doesn't have to be the first word, it could be the second word, pivot phrase. We could talk about, oh, should we take out the pony? Okay, let's do it, take out pony, but we're going to talk more about that. We don't have to work on every single word to make a full sentence. That would be overloading the speech motor system. It would be overloading the expressive language system. So just as it's okay to teach some approximations of words, it's also okay to just stick with what we might call telegraphic language, which only has 2 or 3 words without all of those little grammatical linking words because the children aren't ready for them. All right, so now I'm having trouble moving along. Yeah, I cannot advance.
Can you write
Oh, there we
arrow?
go.
There you
Okay.
go.
Let me go.
Maybe it's just lagging.
I don't know. It's getting stuck.
Okay.
All right. And so my daughter is an SLP in the schools. And I have lots of different materials that can be used with the KSLP methods, but you don't need to have any of my materials to do the KSLP methods. You just need to know what words are we working on? How do we get to the best approximations? And do we have lots of fun toys that the children love? But one of the things that I put together, because my daughter said, hey, you don't have anything for groups, and she works in the schools and she has to be with a lot of groups, but this is called What's in Your Doghouse. And basically it's a matching game where you open up one of the dog houses and you take out what's inside, and then it's really a labeling task of very simple nouns. And then you can go into some pivot phrases of naming the function of them. Let's say you picked out an apple and the child's best approximation is apple. Yes, you picked an apple. What do you do with an apple? And then you can go into eat apple. Yes, you eat an apple. And when you model, you can model all the grammar, but you're not expecting children to produce any of all of that particular syntax or morphology or all the little linking words. I know that many of you have heard from your SLPs, your child's leaving out final consonants. You need to work on final consonants. But what we might not have told you is that if we overemphasize final consonants, we might likely inadvertently teach the child to add something called a schwa. That's an So we don't want something like nap. We want nap. We don't want boat. We want boat. And so there's a very fine difference, but we need to think about, are we the ones that are adding the schwa and teaching them, hey, you want to take a nap, say nap. And we don't want to be the ones that are teaching them an erroneous way to produce those words. So think about final p or a final t or a final, and not saying something like book. Initial consonants can be very tough. And there's lots of words that don't even have initial consonants, like up or on or out or in. And so we can just concentrate on some of the words that don't even have initial consonants. But if we want to work on the initial consonant, let's say that initial consonant of a word is replaced or it's deleted. And we say to the child, say boot, and they say doot. That's called assimilation, and that's a very natural error to occur on a consonant vowel consonant word. But what we want to try to do is keep the initial consonant glued to the vowel and prolong the vowel, and then add the final consonant a little tiny bit later. So if they're saying doot for boot, then we're going to say boot, and give them some kind of a visual cue, and your SLPs should be using some visual cues, and hopefully you're going to know from them sharing that information with you what those cues are that will help the child to know what vowel or what consonant to produce. So you're saying, the child is saying maybe cup for cup. We're going to keep that initial ka with the vowel, prolong it, so say ka, and put on that final consonant. It's usually the influence of the final consonant that's creating the errors on the initial consonant. And by pulling it away a little bit, you're going to take away that propensity. And a lot of the time I'll see something like an SLP even teaching the child to say ba-oot. And that would not be appropriate. We should not be disconnecting the initial consonant, and we should not be adding an to the initial consonant. It's not ba-oot. Okay, and so we don't even want to do ba-oot, and we don't want to do ba-oot. We want to do boot. So those little things that we can tweak are going to make a big difference in the child's intelligibility. So yeah, we don't want to see anybody segmenting away initial consonants. We can segment away final consonants, as talked about, We don't want to segment away initial consonants. All right, number 8, a favorites list. And even if your children are minimally vocal, let's say that they have a few consonants, a few vowels, they're starting to be able to connect them in some simple syllable shapes. We want to know from you, what are the children's favorite foods, favorite drinks, favorite toys, favorite activities, favorite places, favorite characters. And these get complicated because you're going to say, well, you know, a lot of these words are very difficult for my child to say, like the example of Paw Patrol, or even an example of spaghetti. You know, maybe that's on the child's favorites list. So we're going to figure out, all right, how would they best say spaghetti? And without getting into technicalities, they might end up having to say daddy for spaghetti. Or we would just change it completely to nudo or noodles, and then the child can make a request for those things. You know, the thing about single words is, I know that many parents are very eager for their children to connect words and to start moving along into phrases and sentences. But that might be too much load at the level of which they're at. But if we can teach children to use single words to then make a request. So remember, we talked about signing cookie to get a cookie. How about saying their best approximation of cookie to get a cookie? We don't need to teach I want or even want cookie until the child is using lots and lots of single words to make requests. And they can be also requests for actions too. So we want to teach as many of the favorites as possible, find out what their best approximations are, and then we'll write them down the way that you can read them. And then we're gonna, you know, the child might just point, because we're used to that. We know what our children pretty much want. They might be pointing to the TV, and you know they want Paw Patrol to be turned on. But if you know, then you're going to say to them, oh, you look like you want to watch Paw Patrol. Maybe you can get an approximation of a yeah, or a S, or a yeah, or a uh-huh, whatever's best for them. But then you're going to say, oh, tell me puppy. They say puppy, maybe they can't put the Z on it, puppies. But then they'll say puppy, and you know, okay, you want the puppies, you want the Paw Patrol puppies. Yes, let's turn it on. So single word requesting is very important. The child may want to jump on a trampoline, and they might just point to the trampoline, or they might just run to the trampoline. We know what they want to do. And we want to playfully block that trampoline so that they can't just get on it without asking. And we're always doing this in a playful way. We're not negative, we're not punitive. We're smiling, we're playfully blocking that trampoline. We say, oh, I think you want to jump, or do you want to jump? We don't want to ask too many questions, but we can make a statement like, looks like you want to jump. Can you tell me dump? Yes, let's jump. And then you let the child get on that trampoline. So again, we don't need to go into 2- and 3-word utterances until the SLP really truly thinks the child's ready. And they need to have a lot of single word requests to then move into 2 words. And even when we move into 2 words, we might not even move into want. And we're going to talk about that. So we need that list of favorites. Let the SLP look at them. Let's find out what's going to be the best approximation for those particular words. Teach them to the children, model them correctly after you help them with their best approximation, and then help them to make requests in the natural environment. I love this because many different places will have a little notebook of favorite things, or have some kind of area on a laptop for pictures of favorite things. It's really nice to, instead of us contriving pictures of what we think are their favorites, is to actually have the items that are their favorites, and then have them in the therapy room so we can talk about them and best approximations toward those types of words. Scripting and re-scripting is very, very important. And I have to say, if I could teach my parents and caregivers one really important tip, it would be this one. Because children can get by with pointing and grunting and gesturing and whining, and they don't need to be able to get by just doing those very minimal vocalizations. If we can anticipate what the child is trying to convey, we want to help them to convey it. So we're going to have some prior knowledge. What are single word best approximations for their favorites or high frequency words, like their siblings' names, perhaps, or places that they love, but or maybe color words, maybe number words. But then we're going to help them. If they are at a 2-word level, then we're going to help them to produce a 2-word request. So the child is grunting and pointing and whining maybe, and they want a ball. Instead of just going over and giving them the ball, either ask them a question that you already know the answer to, or make a statement about what you already know the answer to, but you're going to use the word ball in your question or statement. So I want to explain that it would be better to ask a question or to make a statement with the item word in the question or statement as a model, rather than saying, what do you want? Or what do you want to do? Because those are very open-ended questions, and they don't give the child any model of what they should attempt to say. So you could say, oh, do you want the ball? Or, oh, it looks like you want a ball. Tell me ba. They say ba because maybe they don't have that final L. And you say, sure, I'll get you the ball. So you're going to model correctly. I have seen this so many times, and I'm a parent too, and I understand that you don't want your child to be frustrated. But if you give in to minimal communication and they could do a lot better, then they're not going to progress and they're not going to retain new information. So every time the child communicates with non-vocal or less approximations than they're capable of, try to figure out what they're trying to say and then help them to say it, either with a better approximation for single words, some pivot phrases, maybe I want to verb, can I have, and we're going to get into those pivot phrases. So we're on number 10. Oh yeah, and we also want to be fading cues. So let me go back to something. We don't want to give the child each word to imitate, because they're just going to wait for you to tell them what to say and they're going to say it. So you'll learn from your SLPs how to fade your cues, and then they are going to be more able to communicate with vocal skills. So let's say that you are at the level of I want to, and then they've been working on verbs and favorite things that they like to do. They like to jump, they like to swim, they like to slide. And maybe they have gotten into best approximations of some of the verbs, or maybe they've gotten to absolute complete production of those verbs, but they still need a little bit of cueing support. We don't want to say, oh, do you want to jump? Tell me I, and they say I, and then you say want, and they say want, and you say to, and they say to. You don't want to do that. We can start them off. Hey, tell me that you want to jump, I, and then maybe gesture the rest and oral posture the words of the rest, where we're just making our lips move the way that those words sound, but the children are doing the work. And the more they do the work, the more they're going to get high reinforcement just by the fact that they're successful, and they're going to attempt vocalizations much more than they're going to just go to limited vocal output. So we talked about those pivot phrases. Here's I want, or I need, I want to. Very often the child learns help me, right? And you're thrilled because you're hearing your children talk, and of course we're excited about that. But anytime something becomes like a habit or kind of an automatic. Anything that happens to them, they'll just yell, help me, and you'll come running. But let's say if we're getting a help me, then let's move it to the next level. Help me to do what? Oh, you want me to help you tie. Okay, tell me, help me tie. Oh, you want me to help you to move that chair. Tell me, help me move. So let's move ahead. And very often we're all people that do this too much is I want phrasing. If we teach too much I want phrasing, then every time we start to cue a child with the word I, they're going to think that the next word is want. Maybe you're going to be working on naming function and it's I eat apple. But as soon as they say, you have the apple and you say, what do you do with an apple? And as soon as you cue them for I, they go to want because it's overgeneralized. And we have to think about overgeneralization. If we do too much on one goal and one goal only and really restrict it, then the child's going to overgeneralize that skill. For some time, I can tell, because I get children from all over the country and sometimes other countries, I can tell what they've been working on and it's been overgeneralized because I'll say, what's this? And I have an apple and they say apple. So they've been working on final k, but it's been overgeneralized. And the only way to stop that is to mix, if you're going to work on final consonants and you need to work on final k, do it, but work on other final sounds and then mix and vary that through with some other goals. Maybe they're goals of pivot phrases or some receptive language task or some other kind of expressive language task. But we don't want to be the reason why children overgeneralize. So here's our last tip, and it's about practicing commenting. And this is going back to how we're working with children through play or in the natural environment. And very often we're asking question after question after question because we're so anxious about practicing, and we've been told by SLPs that we need to do more at home. And so the child comes home from school and you say, what did you do today? Where did you go? Did you make an art project? Let me see it. Are you going to play upstairs right now? And it's question after question after question. And very often too, especially those who have autism spectrum disorders, we've asked so many questions that the children speak with an upward vocal inflection, and that's because that's how we sound to them. And they'll sound like, I want to go, I want to have it, you know, because that's how we have pretty much modeled language to them. We have to be careful about our vocal inflection, and we should try to sound the way that we want the children to sound when they're talking to us. We have to really be careful about that upward vocal inflection. But the practicing of commenting will help to get away from too much questioning. And by that, I mean that, well, let's say, of course, we've got that zoo toy out or a farm toy out, and we've practiced in our head what we're going to work on, you know, what are the important syllable shape words and what are the important pivot phrases or the grammatical skills we're working on. But we want to try to practice making comments and then being quiet, and then we're probably going to get a lot more language from our children that way. So instead of saying, oh no, what does a cow say? We can say, hey, I see a cow. I bet you that cow makes a funny noise. Very different than what does a cow say? And you'd be surprised that you might get a moo, moo from the children, or they might laugh or talk about another animal. So we want to practice words like, whoops, oh no, look at that. Or maybe the cow wants to eat. Or, oh, I see a puppy coming over. I bet you he's going to take that food away, or whatever. Look, you know, a lot of it is about exclamations, but it's a really interesting thing to do. I did it with a family where we made the rules. We were all on the floor and we had a big toy that we were playing with. I said, okay, no one is allowed to ask a question. And you'd be surprised how difficult it is. But I think it's something really wonderful to practice. And because you're not asking for a response. Again, you're not putting the child under performance. You're playing and you're having fun and you're making comments. The child is going to be more likely to want to play, because if they hear question after question, performance, and they know sometimes we parents have a difficult time keeping our disappointment facial expressions from the children. They're going to notice right away, and this is not fun anymore. I'm being asked too many questions and I'm not interested, I'm not going to play. So I think that this would be a very, very good thing to practice. And it's hard, and I can't do it all the time myself. I find myself slipping into questions all the time. So now we're talking about question asking. Now I'm going to say, yes, you can ask questions, and let's take it from there. I'd be happy to try to answer.
Nancy, thank you for all of that wonderful information and ways that parents can help their children at home and partner with their speech language pathologists to help their kids progress. I do have a question that was sent to me by direct message, so I will go ahead and start with that one. And it's actually a question about the Kaufman Speech Praxis Test. So if you guys don't know, in addition to the cards that Nancy is so famous for that are just one tool that can help utilizing her techniques, there's other materials, and one of the things that she has is a test. And the question is, I have a question about the KSPT, the test. What if a child is 6 and older? What is suggested for an SLP to use to assess for apraxia? Okay,
so my test, even though it's norm referenced up to age 6, it's a clinical measurement. It really just gives us information as to what are the children's errors, what are they breaking down on, do they have characteristics of CAS? So without using the norms or the standard scores and percentile rankings, we can certainly still use the KSPT to evaluate a child for CAS and to know where to start in therapy. There are certainly other tests out there. The most current one is the DEMS. Look up DEMS. That's Dr. Edith Strand's test, but I'm not sure who it's norm referenced for. But again, I wouldn't shy away from using my test, because I really think that the clinical aspect of the KSPT is much more important than norms. As long as the person giving it understands what the characteristics are, and that they're getting enough information while testing to know whether or not the child is exhibiting characteristics of CAS. And another thing to say is, sometimes I don't really care if the child has CAS or not. I don't mean to be so flippant about it. And what I mean is, if the child can produce vowels and consonants and they struggle to combine them, I'm going to implement the KSLP methods anyway. And then as I'm working with the child, maybe more characteristics of CAS will make themselves known anyway.
Agreed. Childhood apraxia is very difficult to definitively diagnose. And so I'm with you, Nancy. I don't think there's one specific measure that can give you an answer regarding the presence or absence of that. It's more about the characteristics of the child's speech and how to best meet them where they're at to help them.
And also, if we get stuck on do they or don't they have CAS, I think it's going to trip us up into not necessarily finding SLPs who are well versed in CAS. Because we haven't definitively decided that that child has CAS. I have to say that understanding best practices for CAS is probably best practices for any child who struggles to speak, with the exception of technically other things such as dysarthria, which is significant muscle weakness errors, errors that are rooted in oral structural deviations or differences, which would then result in articulation errors. And sometimes errors because the child doesn't understand the rules of the sound system. In general, you really want to seek out SLPs who understand CAS, whether your child has been formally diagnosed or not.
Agreed. We have another question also about testing. So my daughter was diagnosed with CAS several years ago. How should she be tested again for CAS now after several years of therapy?
I mean, very often we do pre and post testing and we use the same instrument, but then you're saying that it's likely much older than the age of which they were originally diagnosed with a test. Again, I still think it's a set of behaviors that we're looking at, and we're going to look at them again and then take data and notes on what have been the improvements. Do we still see pretty significant characteristics of CAS?
Mhm.
And very often a child will move from what looks like CAS to residual articulation errors. And typically those residual errors are R and sometimes L, and sometimes consonant blends and clusters or multisyllabic words. And there's a progression. And if those are the things that they end up with, we still need to then focus on those. We might take a different approach if it's about articulatory accuracy.
Great. I agree. I agree that apraxia really isn't, there really isn't a test for apraxia. It's more about looking at the characteristics and treating those. Any other questions from anyone? We did have a comment from Laura Friedman that you can always use dynamic assessment as well. And what that means, if you're not a professional, is it's just a way of talking about an ongoing assessment. So you're always assessing a child. And really, I think, and Nancy, tell me if you agree, when you're working with a child, every production you're assessing how they can do it a little bit better and how you can challenge them a little bit more.
Sure, it sounds like something that would be useful to do.
Yep, and she says multiple assessments, both formal and informal.
Mm-hmm.
Any other questions? Yep, we've got one. What would be the best way to determine if a therapist really understands how to work with a child with CAS?
Well, that's a difficult question to answer in a very brief time period. So Apraxia Kids, apraxia-kids.org has a professional directory. And so you can look up your city and see if there's somebody on the professional directory that has been identified as someone who has knowledge in childhood apraxia of speech and its treatment. But I think in general, if you see an SLP just taking one or two sounds, one or two consonants, let's say, and then working them through syllables and words and phrases and sentences, that's not CAS therapy. So on that Apraxia Kids website, you can find out what constitutes best practices for CAS therapy. There's a great deal of information that can be gleaned from apraxia-kids.org.
I agree. And talk to your therapist. I mean, ask them questions about the strategies that they're using and why they're choosing those strategies, and that'll help you, give you some insight as well.
And for example, if you hear your SLP going, say, but-oat, you know that they don't necessarily have the knowledge on what would be best practice in CAS.
Okay, any other questions? Anyone else out there? We've got about 5 more minutes. What is your recommendation for bilingual child with apraxia of speech? Shall we focus on one language?
That's such a good question.
A big question.
Well, we want to honor the child's native language. If they're going to be educated in English, then they have to hear English in their home. Some of the time, not absolutely completely, but they need to hear the nuances of the language that they're going to be educated in. And I think that I'm hoping that if I'm guessing, I guess I have to say, that SLPs aren't necessarily multilingual. And so they're going to have to work in English. But if you learn what are best practices in English, they hopefully can be transferred to the other language that the child is speaking or that their families are speaking. There might be a better answer. I'm not an expert in, children that are speaking different languages, but I'm restricted by the fact that I don't speak their language. I have worked with children who have apraxia of speech in Spanish, but that's because I have some knowledge of the Spanish language. But it would be the same principles. Find out best approximations. Phonetical processes, and that's the way in which we choose how to simplify words and find out their best approximations, are pretty much standard across different languages. So that's a plus. And so I would say that if you could find somebody that speaks the language that the child's family speaks the most, you could work on it through that language as well.
Agreed. It's the same principles. It's just making it to the point where the child can be successful, taking the word and breaking it down to the point where they can be successful and building it from there. Any other questions, everybody? If not, we can end a few minutes early. I'll give it just a couple more minutes in case someone's being shy and wants to type something. Okay. Oh, we've got one. We're moving from Brazil to Houston in a couple of weeks. And oh, I'm looking forward to coming to Carruth. Yay, Letitia. We'll see you soon. That's wonderful.
I have to comment on that question. I think that Carruth is outstanding. And if you have the opportunity to be a member of the Parish school, it really is one of a kind. It really is truly an amazing program. And I highly recommend it for any child who struggles to speak if they meet the criteria.
Thank you, Nancy. Those words mean a lot to us. We really appreciate that compliment. I am going to go ahead and let's wrap this up. Oh, we have one last one. And that is, do you have experience in working with deaf or hard of hearing kids with apraxia?
Yes, actually I do. I don't have a lot of experience there, but the principles don't change. If the child has adequate hearing with aids and they continue to struggle to speak with consonants, vowels, syllables, combinations, I would employ the same principles as I discussed tonight.
And we've got one more. Is there any advice for handling backslides? So regression.
Oh. Regression is an interesting term. I'm not really sure what everyone means when they talk about that.
And I'm assuming that's what this parent's mean. He's saying loss of words. So the child, I guess, was talking and then stopped talking or was talking less. Yep, we got it.
I think that child would actually need a comprehensive evaluation, possibly by a developmental pediatrician or full psychoeducational evaluation, because we want to make sure that there's nothing neurologically challenged about that child's development. Yeah, I mean, I think that you would want to talk to a physician as well.
Yeah, I agree. Okay, we are at 7:30. We're getting thank yous, and I thank everyone for spending their night with us, and hope to, sounds like I'm going to meet some of you guys soon. And thank you to Nancy for putting all of this together and helping us year after year after year develop our programs and develop our skills. We cannot thank you enough and think the world of you.
Thanks, everybody. I so appreciate having this opportunity. And feel free to email me, nancy@kidspeech1s.com.
Good night, everyone.
Good night.